Cannabidiol, the future of drug-resistant epilepsy. For our bodies to function properly, electrical signals are passed between our brain and tissues along complex systems of nerve pathways. The impulse travels from the presynaptic neuron to the postsynaptic neuron via the synaptic gap. When this system is disrupted and there is a burst of electrical activity in the brain, the neurons are uncontrollably hyperactive due to many excitatory neurotransmitters. This produces a seizure, which introduces physical convulsions, abnormal behavior, or even loss of consciousness. The condition where a person experiences recurrent seizures is known as epilepsy. Epilepsy is the fourth most commonly diagnosed neurological disorder, with more than 65 million people suffering from this condition. Endocannabinoids such as 2-AG are non-classical neurotransmitters in our body that influence the nerve impulse traveling across the synaptic gap and are thought to suppress excessive neuronal activity. When the neuronal firing rate is increased, a reaction is triggered in the postsynaptic bulb to release endocannabinoids. 2-AG will then bind to the CB1 receptors from the presynaptic neuron where the signal originated from. This will cause the calcium channels to close in the presynaptic neuron, slowing down the release of neurotransmitters. Manipulating the endocannabinoid system can help with controlling epilepsy. The cannabis plant contains over 200 phytocannabinoids, including D9, tetrahydrocannabinol, and cannabidiol. THC produces the effect of what we know as a high, however cannabidiol does not exert these psychoactive effects. Phytocannabinoids like CBD interact with the body's CB1 receptors to reduce seizure likelihood and severity. However, other studies indicate that this interaction doesn't account for the anti-epileptic action of the drug. Rather, the desensitization of the capsaicin channel causes the reduction in neuron hyperexcitability, contributing to the reduction of seizures. Although the exact cellular mechanism of CBD in reducing seizures remains unknown, its efficiency is proven in clinical trials. A retrospective study conducted in 2016 observed the effects of CBD on 74 children between the ages of 1 to 18 with intractable epilepsy, of which all the patients were resistant to more than 7 different types of anti-epileptic drugs. After 3 months of a daily dose of 1 to 20 milligrams, 89% of the patients report to have a reduction in seizure frequency. A similar notion was investigated in an open-label study conducted in 2016. However, this study had a large sample size of 214 patients between the ages of 1 to 30 that also had severe treatment-resistant intractable epilepsy. After 12 weeks of treatment, the frequency of seizures reduced from a median of 30 to 15.8 seizures per month. However, 59% of patients experienced adverse effects including decreased appetite, diarrhea, fatigue, and convulsions. However, both studies did not discuss whether cannabidiol affected the type of seizure observed, nor if the medication affected the brain activity during a seizure. Hence, further research is required, particularly randomized controlled trials, to determine the drug's safety and efficacy. The current treatment for epilepsy is the use of anti-epileptic drugs. They aim to inhibit the generation of repetitive electrical activity in epileptic foci. Similar to CBD, anti-epileptic drugs manipulate neurotransmitters by blocking sodium channels to prevent depolarization, blocking calcium channels to reduce transmitter release, or inhibiting excitatory neurotransmitter action by blocking receptors. The idea of using cannabidiol for medical purposes remains to be a controversial topic in society due to the lack of knowledge about its pharmacology. The main concerns that fuel the controversy stem from the unknown elements, cannabidiol, and the psychoactive THC. As these are valid concerns, researchers have been investigating optimal concentrations whereby the medication will be effective with THC doses below the threshold level of intoxication. Other social implications surrounding the use of CBD as an anti-epileptic drug includes monitoring the abuse of the drug and providing schemes to lower its cost to eliminate the need to source cannabidiol illegally. Further research would assist in speculations about cannabidiol, however, it does hold great potential in regards to treating drug-resistant epilepsy. Cannabidiol, the future of drug-resistant epilepsy.